Bismillah wa salatu wa salam ala Rasulillah. I would like to welcome you to the series of history taking and physical examination for the neurological problems, and this is aimed for all interested in the neuroscience, from a medical student, an intern taking a rotation in the neurology, neurosurgery, psychiatry, and the residents in the training program of these specialties, as well as specialists and consultants interested in this field. Since I entered the medical college, I found that the nightmare of medical students, as well as interns, and even during my residentship, I see that my colleagues are fear from taking a proper history and performing a proper neurological examination. Well, I mean a real step-by-step neurological examination. Well, on the contrary, I was enjoying this. I attributed this for reasons, actually. The first and most important is my keen to learn this thing. So if you like history taking, if you like to perform the proper neurological examination, I'm sure that you will master it. Second, nothing comes from black. You have to start from the scratch. And scratch here, I mean an important and a solid basic of neuroanatomy knowledge. And the most practice, re-practice the technique. In the beginning, on yourself, on colleagues, and of course on seeing more patients and patients. I'm making this series on the web so that it will be available for everybody. And this is the experience of the years and years that passed since I started my practice. I found that almost more than 80 or 90% of the diagnosis is based on history. So I always say history taking, then a proper history taking, then a proper history taking, and then we come for examination, and we end by investigation. Nowadays, I'm seeing that many of the practitioners will jump to the investigation immediately, without knowing the real problem, where it is anatomically, and what is the underlying pathological category. Well, here lies the mistakes. A primary objective of the medical student and resident rotating in the neuroscience service will be to obtain a thorough neurological history and perform an excellent professional neurological examination. Our objectives throughout the series of this history taking and neurological examination will be obtaining a thorough neurological history, a simple evaluation of the mental status of the person you are examining, and then we will go through the systems. Now, examining the cranial nerves, examine the different sensory modalities, the cortical, the superficial, and the deep sensation. And then examination of the motor function, examination and grading of the deep as well as the superficial reflexes. And then we should evaluate on the cerebellar function and observe the gait of the person for any abnormalities that might be detected.